whole heart. Is this the one that's damaged? No. Okay, let's look at the major vessels again. When you're looking at the heart, if it's protruding forward, that's the anterior. If it's kind of indented, that's the posterior. So when you're looking at it the way it would be in the body, the very first vessel you'll see up front, and it's always going at a slight angle, is the pulmonary artery or trunk. Then, right behind it is the aorta, right there. And then just to the right of the aorta, right next to it, is the brachiocephalic, right there. Those are the three arteries.
Pulmonary?
Pulmonary artery or trunk, you can say. Aorta and brachiocephalic.
Aorta is the one literally right behind
This
the
one,
pulmonary.
yes, literally behind that one. Okay. Now, this is the right atrium, this sac. And if you have the right atrium, of course, you're going to look for the superior vena cava, and that's this. That's the superior vena cava going straight down. The inferior vena cava is kind of hidden in the back here, and there it is. And you can hear them going through, so that's the inferior vena cava coming in from there. Okay. And then you have the pulmonary veins, this big guy right here, going into the left atrium.
Oh, so you don't see all four of them?
No, because it was cut too close in the slaughterhouse. So that's, oh, and don't forget these vessels on the exterior are the coronary vessels. They're on the exterior.
Okay.
See, this is going to fall out. You know what I'm going to do here? For this one, just to make it easier, I'm going to do the following. I see what I'm doing? There's the superior vena cava, and that's coming out of the inferior on that side. It'll last longer that way. Okay. Now, when the heart is opened, and let's say you just have a half of a heart on the tray, always orient yourself immediately. Make sure what's right, what's left. And when you're looking at, for example, this, the best way to find out if you're right or left is to look at the outer walls. The thin outer wall means you're in the right ventricle. The thicker outer wall means you're in the left ventricle. And this is another clue that this is the right ventricle, besides the fact that the wall is thin. There's a moderator band, only in the right ventricle. Else. What's this right here? This is the interventricular septum. Okay. Now, once you orient yourself to which ventricle it is, that's also going to help you in case there's a pin in a valve. Now, this is a papillary muscle, not that large because it's on the right side. Here's the chordae tendineae, and that's the valve. This sheet right here is the valve. And you would know what valve this is because you're in the right side, so this is the tricuspid. Remember I said tri-right. That's the right, that's the right ventricle, this is the tricuspid valve. Now on this side, this is a much larger papillary muscle. The left ventricles have larger ones. There, once again, is the chordae tendineae, but unfortunately, just a small piece of the bicuspid and mitral valve is left on this one. So maybe better than that would be this. Here we go. See, once again here, that's right ventricle. This is left. And you could see that all this that I'm picking up is all a valve. This too. And you see it's coming from the chordae tendineae, right there. And that's coming from a papillary muscle. That's the bicuspid or mitral valve. In the atria and also in the lower part of the ventricles is a muscle called pectinate muscle. There it is. It has a honeycomb kind of arrangement. And it's also on the bottom of the ventricles. For example, yeah, it's right here. If you look right there at the bottom, you can see that honeycomb arrangement again. That's it too. That's pectinate, as opposed to this one, which is papillary muscle. Okay. Now, because this is the left ventricle, and this is the aorta coming in, right at the base of the aorta is another valve right there. Remember, if you see a valve that does not have chordae tendineae coming out of it, it's a semilunar. There's the other flap. This is the aortic semilunar valve. Now, to find the pulmonary semilunar, there's really only one way. You got to, so let's do this one for a second again. This is pulmonary artery. That's aorta, and that's brachiocephalic. Now, this pulmonary artery was purposely cut open because this is the only way you're going to find the pulmonary semilunar valve. When you open up this pulmonary artery like that, there is the pulmonary semilunar valve. There's the other flap on that side. So, use common sense. If you see that the pulmonary artery is split open, and there's a pin there, and the card says, name this valve, it really is going to be the pulmonary semilunar. Okay? And when you're looking at the heart again, which are the ventricles? These are the ventricles. I'm sorry, I meant to say the atria. These little flaps are the atria. So this would be the left atrium. This flap here is the right atrium. Again, pulmonary artery split open. This is the aorta. There's the brachiocephalic. See, now, this heart is not a good heart for the superior and inferior vena cava because whoever was working on this sliced it in such a way that they made the superior and inferior vena cava one giant hole. See? So that's very difficult to do. So this is a better one right here, where it wasn't cut. Superior coming in from there, inferior from the bottom. Once again, these are chordae tendineae. That's a papillary muscle. What's this valve? Okay, that's incorrect because, remember, tricuspid is the thinner outer wall.
On the right.
This is the thicker outer wall, so this was
The
the
bicuspid.
bicuspid or mitral
Mitral
valve.
valve.
Okay, here's the aortic semilunar again, right there. There's the aorta coming in. See, you can tell it's the aorta. See, there's the brachiocephalic. There's the aorta. Let's bring it up. See the aorta? It's coming right past that aortic semilunar valve and into the left ventricle. Did we cover everything? I think we did. So if you want to work with